Good morning. It's a very wintry cold morning here in Bathurst, and today we have a very special guest, Dr. Nicki Wiedmann, who is our veterinary practitioner for small animals here at McDowell's Herbal. So I'd like you all to say hello and welcome to Nicki. Hi, Nicki.
Well, thank you very much. Thank you for inviting me, and hello everybody out there. Good morning.
So some of you, if you are regular customers with us, will probably be already in communication with Nicki, who works at least one day a week and, of course, backs up when Kate or I go away on holidays. So, and Nicki has been with us now for, 3 years?
Yeah, three and a half years.
Yes. Which is really amazing. And I met Nicki running a course for herbal medicine. She actually lives in the Blue Mountains in a beautiful valley called the Canimbla Valley. And David and I at that time were living at the Megalong Valley, so we were kind of just around the corner from each other. And it just seemed to be a really nice synchronicity, wasn't it? When we met, and we've just got on like a house on fire ever since. And Nicki has brought an enormous amount of sunshine into our daily workspace. But I'm going to pass you on to Nicki because she has an interesting story about her association, not only in her own work practice. So tell us a little bit about you and where you're from and your history with veterinary medicine, but also how you came to be working for McDowell's and your opinion of McDowell's and what we do.
Of course I will. Well, I was born and raised in beautiful Bavaria, that is South Germany, and it's a place very close to nature. And I was used to herbal medicine from my early days, with going with grandma, going on the meadows, picking arnica,
beautiful.
For the bruises what we have as kids.
Yeah.
And then I was fortunate enough to be accepted at vet school in Munich, so I went there and graduated early 2001. And from there I went straight to small animal general practice in England for 10 years. And during that time I've specialized in veterinary herbal medicine. I found, when you are in veterinary practice, you have a huge amount of tools when it comes to diagnostics. You have your surgery, your acute cases, but there's a real lack when it comes to chronic cases, where something to stimulate healing. And I thought there's a really lack there, and this is where herbal medicine is coming in. Yes. And then when my husband and I moved to Australia early 2011, then I practiced herbal medicine only. And one sunny afternoon I received an email from David, thank you David, inviting me around and having a look at McDowell Herbals and if I would be interested in stocking your products. And then we met, and then it all went very, very fast, didn't it?
It did. And Nicki has really contributed an enormous amount of knowledge to the practice as well, which is we're very grateful for.
Well. The knowledge is all yours. I have to say, I'm still deeply impressed with everything what you are doing here. First of all, your deep understanding of any kind of diseases, and you're not limit yourself to human diseases and specialize in a certain area. You know pretty much all of them. There's not a disease out there where you cannot say a sentence or two about it. What I find really remarkable, and that goes over to the small animals and continues with, I think, what your passion is, the horses.
Absolutely. The horses are my thing.
Very, very remarkable. And then you have this deep understanding what is going on in the bodies, when they are presenting with a disease, and then the understanding how to correct it. And not only from the Western medicine side, but also from traditional sides and from holistic, you have a holistic view, what is actually going on in that body and what needs to be corrected.
And I think that's probably a good point, because we have Kate, who was married to a vet and is a vet nurse. I was a vet nurse, and plus I did equine science, and with now Nicki's scientific background, and now we're able to marry the two, traditional craft with the more modern scientific craft, and try to get that nice outcome. Which is why when we say you need to see a vet, we mean it. because we can't, number one, we don't diagnose. That's not what we do. Once we know what the disease process is, and today we're going to be talking a little bit more about cancer, but once we know what the disease process is, we can break it down and we can provide support for the body systems that are actually fundamentally being affected primarily. And I think if you're following this series, you'll see that link between my favourite system, which is the neuroendocrine system, which is something that Nicki was introduced to when she started working here.
Fascinated, that now coming to your herbal formulation, I only can say they are so sophisticated, and you're addressing so many things. Some herbalists are tempted to, you have a problem, with an organ, let me say the lung, and you're tempted to whatever, just go for lung herbs, but no, you don't. You support the cardiovascular system as well. That is equally involved if the lung is in trouble, and then of course the neuroendocrine system. How you describe it, you have the communication in the body has to work. To get everything back in order.
Exactly. So, and I think this is one of the key elements, and it is one of the differences with our treatment protocols, is encouraging that intracellular communication, the immune system communication, which I don't just see as the immune system, which I know that the like a physician would see the immune system. It's not just the lymphatics, and white blood cells and red blood cells. It is actually how the nervous system is communicating itself to inspire all of those systems to work together, which is why we get this more holistic and synergistic effect with the formulations. So that leads us on to cancers. So
one moment, I have to say something to your formulations with also integrating, the Bach flowers.
Oh, the Bach flowers,
addressing the emotions,
the emotional side,
and bringing the body to a state where it can heal. So many, because we will talk about this, that emotions play a role in the development of diseases.
Absolutely.
And they have to play a role in the healing as well.
Absolutely.
So that makes, sorry, I just feel I have to say, what makes McDowells and Cath and her formulations so unique. And another unique thing is the trigger point dosage.
Yes.
What I found very, very fascinating, because when you are trained as a herbalist, you go in with rather large dosages on the principle of pharmaceutical drugs. You have an active constituent in your herbal tincture, and this active constituent is doing something in the body, interfering with something.
That's right.
That is, the idea about it. But with the trigger point dosage, what is the lowest possible dose to trigger a healing response? This is not the case. You don't get to a dose load that could interfere with body functions.
But with body functions and also medications.
So, but yet we still get results, and this is fascinating. And when you work with animals, if you stick with the recommended dosages, the high dosages, you end up just having Labrador owners as clients, because no other dog, or God forbid cat, would take these amounts of herbs.
Exactly. They couldn't do it. So
it's just it's not possible. Whereas with the trigger point dosage, we just put drops, just a few drops, and it makes such a difference.
It does, and it's might be slower to work, but I think it's more of a profound treatment because it's a genuine transformation at the DNA level, and also the way the body is over time. Informing each of its own systems to work, and that again is our whole aim with our formulations, is to create that total transformative effect for healing. So let's talk about, because today's our topic is cancer.
Yes,
and Nicki probably does deal like Kate does. I'm not as much dealing with the canine cancers now as what I used to be, because Nicki and Kate tend to do those. So tell me, what is your primary cancers that you're seeing in the practice?
Now, one cancer is really outstanding, and this is the osteosarcoma. And I know why that is. When your dog gets diagnosed with osteosarcoma, conventional veterinary practice has not much to offer. There is first the limb amputation, right, just to take the pain away. Osteosarcoma is an incredibly painful cancer, poor souls, but it also spreads rapidly.
It's very aggressive, isn't it?
Very aggressive. So when you in veterinary practice, it all goes much faster than in humans. You know, when the dog comes in, presents with the problem, they get into surgery very quickly if owners decide to go for this. But even if you have surgery a few days after the diagnosis, you know, it might have already spread, and so the outcome, even with an amputated limb, is not very good. It's not very good. I have not much experience with chemotherapy and radiotherapy in osteosarcomas. We haven't done that in practice, but what I can read up, it's not. They cannot give much hope, even going down that route. And of course, it is. You don't want to make the last days of a patient miserable. You would rather enjoy, you know, having a good time.
And I think it's important for owners to understand that our dogs and cats or animals don't understand disease like we do. Like we understand, you know, that there's going to be a death at some point and a parting. But our animals don't have that degree of consciousness about it. You know, they have a consciousness in terms of feeling pain and they feel the fear, and they feel the fear of your fear. But from their perspective, and the sadness as well, they do feel that. And of course, any pain will of course make them feel sad and obviously quite depressed. So when I'm talking to clients about chemotherapy with their pet, it's important to recognise that we're not putting our own emotions and our own desires into the animal's experience, because the animal actually is experiencing itself just as it always has done, with maybe a little bit of a sore leg. That's basically what it is. And once you start putting chemotherapy into the mix, those sorts of medications are incredibly debilitating, aren't they? I mean, they do have quite significant side effects. So there is a lot to weigh up there, and it's a very individual choice, as what we say for people who are experiencing cancer as well. So let's break down a little bit what we think's happening with cancer. So cancer, as far as what we're concerned, is pretty well much the origins of cancer is the same as any kind of disease process as far as we're concerned. We don't differentiate cancer as being this thing outside over here that doesn't have a relationship to what else is going on in the body. And that's because we see everything as interconnected. And so the origins of cancer are the same as the origins of any disease. So, okay, so did you want to extrapolate on that?
Yes, I mean, if we have this cake, you know, what contributes to diseases, the biggest chunk is diet.
Yep, okay.
That counts for animals as well. Then we have this chunk of toxins, you know, the environmental pollution. Everything what we eat is not clean, you know. Dog goes for a walk on land that has been sprayed, you know, that all adds. Then also treatments, anti-parasitic treatments. The regular use of anti-parasitic treatment contributes to the overall toxin load. Then emotions play a role in the development of disease. Stress, lack of exercise. Then you have your genes. It's probably just a small
it's
small
a very
part.
It's a small part.
Could be argued about.
Yeah, well, it depends on which research, and this is where, if you've been watching any of these series where I've talked about the Otto Warburg theory, the metabolic theory of cancer, and the genetic origins of research, and how back in the 40s there was a decision was made to follow the mapping the genome, and that the genome became the magic thing to try and work out, but actually it hasn't yielded since the 40s, so over 40 years of research, it hasn't yielded the information that they were hoping. And the reason that was the case, just for, you know, they could patent genes. They could create this biological treatment and patent the gene. So, I mean, there's no money in not patenting something. So that's where the research money goes, unfortunately. So that's why the idea of this holistic approach has been given such a wide berth, because no one can really make a lot of money out of it. That's the reality, unfortunately. But from our perspective, we don't mind, because we're happy just to exist in a more normal world. We don't need to be billionaires. So we can just be a little bit more normal about what we're doing. So let's talk a little bit then about the types of dogs that would be susceptible to osteosarcoma.
Usually it is the large to giant breeds, but I get more and more smaller ones. And I have the feeling, yes, of course, we have this global clientele, and we get whole lot more cases than the normal general practice.
Particularly in the US, we do see a lot of dogs in the US with osteosarcoma. In fact, we would be getting 2 or 3 inquiries a day at least on that condition alone.
But even when you are in small animal practice and you have a radius of, let me say, 30 kilometers, you will get them very, very regularly.
Oh, yeah, right. Okay, that's interesting. And do you put that down to maybe environmental impacts?
I think everything has
just
a
everything
role to play.
Yeah.
Everything. Of course, when you're talking about the giant breeds, then probably the genes are coming in.
Yeah.
And now we get medium-sized and sometimes even small dogs.
I know. And I'm seeing it in horses as well.
I had a cat.
Oh, really?
Osteosarcoma, one cat with osteosarcoma. I think this cancer seems to it's becoming. So there's obviously something happening in our environment that is obviously impacting, and I think we can safely say that number one is diet. Yes.
So we might just quickly discuss the other cancer that we see a lot of, which is mast cell.
We see every type of cancer.
Squamous cell carcinoma, adenocarcinoma, all kinds of cancers. But these two are probably our primary ones. So the mast cell cancer is an interesting one, because that particular tumour is often not diagnosed till it's quite advanced, because a lot of the time it just looks like a hot spot. So it can just sort of look like something, a bit of an ulcer, or might even be thinking, it could be a squamous. Yeah, it's just a skin, just a clump of something, and then eventually it does get diagnosed. And once that's the case, but let's have a look at the processes involved there. I mean, it's high level of histamine operating in a localized area. So when that happens, just touching that area can actually increase and release the amount of histamines that are being produced at that site, and that will make the cancer worse. And if we think about what a histamine is actually trying to do, I mean, it's a chemical that's interrupting what the body's natural healing response is. So it's like all cancers, it's a healing response gone wrong. There's always an inflammatory response as the first sign of cancer. There's always the misinformation of the body trying to heal that, and then there's the impact on the DNA as a result of that misinformation. So that's how we see that process of DNA destruction. The DNA starts to break down and is misfiring, so you're not getting a few things happening. In general cancers, it's apoptosis, which is cell death. So as the body produces cells to heal and repair, you want each of those cells to be in good order, so healthy. But if that's not happening, often you'll get this cancer where the T cell or the terminator gene is not actually being brought through to the next cell. So the cancer cell itself doesn't know when to die.
Yes.
Okay, it doesn't know when to die, and so that's a really interesting phenomenon with this. So this is it's the information that's happening.
A cancer cell is quite intelligent in itself.
It's a very intelligent.
Produces chemicals that basically makes the surrounding tissue cells slaves, and they don't function proper anymore because of this influence. So it is cancer in itself is a very interesting thing. And one of the things that we find and what we want to try and work with, which I think you've been working with, is getting Trojan horse cells to come in and bring
substances into the cell and help the cell basically break down, because there's a few things about cancer cells that are unique, and one is that they have no antioxidant protection. So bringing oxygen into that cell and having super antioxidants to protect the healthy cells around the cancer is a really good idea, and so we use maritime pine bark for that. So we find that's a really effective process. But the first thing we want to do is actually detox the body.
Yes. Now this leads us to our treatment
programs,
because I think you started with the tincture or the mixture that is supporting the cells affected by the cancer, and then in combination with your antioxidant support. But over the years you have developed even further, bringing in the importance of detoxification of the body.
That's right.
So every of our cancer treatment programs has at least 3 components.
Exactly.
And the detoxification is
it's very important.
And our 2 power mixes of that is the Infectaclear, what is the blood cleanser, and the conditioning tonic.
That's right.
And these 2, depending on the type of cancer, we are hoping is clearing and bringing the metabolism back
to a degree of harmony.
Yeah.
So that's how we always start. So we always start with a detox, supporting organ function. Then the cancer program or the specific cancer mix will have Trojan horse type herbs in there. Like it'll have your wormwood in there. Likely it'll have parsley and rose hips. It'll have violet leaves for your lymphatic system, plus your range of bark flowers. And in other cases, it'll have herbs like equisetum, which is a very deep blood detoxifier, but also very, very good for tissue repair. And yarrow's another one for that.
Elecampane.
And elecampane as well, which has a multi-function in the body. So let's talk now about how much time we've got. Do we want to answer some questions now? Have we sort of talked enough about what we think cancer is and our approaches to cancer?
So we've got specific questions coming in now about specific cancers. Let's start with one that is my dog's mast cell tumour was removed, his ear, which was removed. So we've been focused on treating his spinal stenosis of unknown origin. Can I expect the maritime pine bark? These people are obviously already on mixes.
Yep.
The maritime pine bark and conditioning mix help without having to use the specific mast cell protocol.
Do you want to answer? Do you want to answer that one?
I might just ask a couple while we're going. So that's a mast cell.
Yep, I've got a mast cell cancer. Yep.
Then there's someone who has asked whether there's herbal supplements or a regime that could be implemented into a dog's diet to assist with the potential prevention of cancers, because other people have suggested that, as Nicki had said, that once they get osteosarcoma, it's often fatal even with treatment. After amputation and with treatment, they may not last too long. So basically people are asking, is there a prevention?
Yes.
So let's go on to that one. So we've got mast cell prevention. Then we've got a canine lymphoma question.
Yep.
Let me just see. She's been diagnosed with canine lymphoma. When she was a puppy, she had a terrible reaction to her puppy vaccinations. That's a vaccination and lymphoma question. So we always get those.
Touch on that topic.
So I'll leave you those 3 so far.
Okay, all right. So Nicki, if you start with the mast cell and the diet.
Mast cell is your topic. Okay, and diet is my topic.
Okay. So let's talk about the mast cell. So if your dog had mast cell tumour and it's been removed and it's not active, that's telling me one thing. One is that there is an inflammatory response in your dog's body, and also it's an allergic response in your dog's body. So whilst we may not necessarily see this manifesting in other areas, I would suggest that there probably might even be a history of skin issues with this dog, potentially. So that's where we would start with the Infectaclear, and maybe even something like an allergy formula. So we can work on. So what we need is anti-anaphylaxis herbs in that kind of formulation. And herbs that come to mind to me are straight off the cuff would be euphorbia and chamomile would be my two primary herbs to use in that kind of situation. But without knowing more about this dog, of course, we would look primarily at your maritime pine bark, an allergy formula, and I would definitely be doing either a conditioning mix or a detoxification with this dog. You would also maybe want to add in something like evening primrose oil, which has its own interesting support, which if you look at our mast cell program, it includes the evening primrose oil, which has incredible effects within the body, particularly through the hormones in the body and those prostaglandins that are required to help inform the body on how to respond appropriately with its inflammatory responses. So anything that's anti-inflammatory is where we would start there in terms of diet, and then of course the herbs. Maritime pine bark would be an absolute given in that situation. No matter what you're doing, maritime pine bark is, as we explained, one of the key cellular protective herbs that we use. It also has a multitude of other benefits besides being a super antioxidant. It's anti-aging. It's
He does have skin allergies.
Oh, he's got skin allergies, which makes sense. That totally makes sense. That what we've got is skin allergies going out of control, and that's turning into that mast cell. So I would definitely be looking at, the mast cell program would still be fine. It includes everything that you would need for a dog with allergies. So, that could be a good option. Yeah, that program. And of course, diet. So I'm going to let Nicki talk about diet.
Now, if you want to know what you can do to prevent diseases, especially cancer, then two things are very important. And the most important thing is diet, and the next important thing is exercise. Mm-hmm. This is really vital for
humans and people and horses.
Yes, and everyone.
Everyone, everything, everyone.
Now, stay away from processed diets. They all look good on the outside. And
marketing,
yeah, you have this beautiful steak and this beautiful veggies around with this happy smiling dog. But it's, most of them are so heavily processed, and heavily processed diets cannot provide the nutrients a healthy body needs. And it is most inconvenient because you have to do it yourself, but it is paying off in the long run.
Absolutely.
Definitely. And, there are certainly some fresh veggies, like broccoli, what you can add to the diet. There is this debate about should I feed broccoli to my dog or not. Have been a few studies that broccoli is linked to some gastrointestinal upsets in dogs. My answer is definitely yes. Don't overdo it, then you're always on the safe side, not more than 10% of the diet, but broccoli has some anti-cancerous...
I think all brassicas do.
Yeah,
all brassicas do. Cabbage and cauliflower and kale, Brussels sprouts. Yeah. All those are actually amazing foods for you to eat as well as your animals. And yes, they can cause gas because of the high level of sulfur, particularly in cabbage. That's what causes that gas. But, from a perspective of health, it's not just the nutrition that it's providing, it's the enzymes. Yeah. That's coming through.
And probably there are even more
there's
nutrients in fresh foods
that we don't know
that we don't know about yet. But it is just absolutely essential. And if you can feed raw, then it's better than cooked, because you will lose especially the enzymes in the cooking process. And making your own dog food, it's not that difficult. When you first remember the day you were first driving a car, you think too much about it and it feels scary and whatever, and now you're not even thinking about it anymore. And it's the same with making your own dog food.
And I think the thing that people are most anxious about and very nervous about is that there is a lot of fear mongering, particularly from the veterinary profession, about raw food, killing animals with salmonella, and there are certain foods you can't give them. Don't give them raw because you don't know actually what to give. I mean, come on, like, you can learn about what to give. So I mean, that those excuses and those warnings are for people who are so terrified they can't, think outside of the square. But we're encouraging you to do that.
Yes, definitely. people want you to think that you are incompetent to feed your dog. You are not. You just
Absolutely
use
not.
your common sense, and maybe do a little bit of reading, and it's not that difficult, and it will help your dog
And it's not
your
going
cat.
to, and you're not going to kill your dog by
Yes.
experimenting a little bit with diet. And I'll just make that note on.
Just a few things. Don't onions is a thing not to give, and from the fruits, grapes. But other than that, you can pretty much
Experiment with your basic normal European vegetables. So your brassicas, sweet potatoes, pumpkin,
potatoes.
All those things are fine. Even if we're talking about a keto style diet, which
is a diet used in cancer patients, humans and animals alike. And the difference is that cancers feed on carbohydrates. They are glucose hungry. So everything with grain, you feed the cancer, but not the patient. So the ketogenic diet, the idea is to take all the carbohydrates out, have a medium amount of protein, but go very, very high with fat, and basically change the whole energy metabolism of the body, that they get their energy from ketones rather than from glucose. It is they have treatment success with that, no doubt about it. It's still a quite radical.
It's a radical approach,
diet,
which if you want to go down that road, you can, but we don't necessarily go that extreme with our recommendations.
It's also depending on the patient. If you have a carnivore that wouldn't touch veggies, you have these different type of patients. The ones are so happy to eat veggies and only veggies, whereas others wouldn't touch them. So if you have a real carnivore dog, then probably a ketogenic diet is a very good idea. If you have a dog that is quite happy to eat whatever you present your dog with, then I personally would use fruits and veggies, for their benefits, nutritional benefits.
And that includes, I like the fact you mentioned fruit, because now what type of fruits would you?
Well, basically apple, pears, that's a good start, and you can go down the whole variety. You can give bananas, and don't forget the blueberries and berries.
My berries, I love berries. I'm a real berry person.
Grapes, there's concern about grapes that it can cause kidney failure in dogs. It's still the question, is it the grape itself or something the grape has been sprayed with? So don't go for grapes if you want to be on the safe side, but other than that, any fruit, what your dog likes,
So we have quite a lot of this information on the website too, as well as we do offer the one-to-one consultation. So if you do need more information, please email us, because we can do a lot more personalised discussion.
So there's someone here who has talked about diets. First of all, he says, thanks for holding a live event. He's also got a dog that was diagnosed with osteosarcoma a month ago. She's a 10-year-old and has been eating a home-cooked organic diet since 6 months old. Sounds like a very good diet. It's got diet consisted of chicken, brown rice, sweet potatoes, broccoli, blueberries, shiitake mushrooms. She's extremely healthy. Otherwise, anything that could have been done apart from what he did. So the dog's got osteosarcoma. Now the only thing I can see there that's different is it's a cooked meal, and the dog is 10. Now I also want to get some more information from you about the comment you made about grains feeding cancer. I thought that was interesting, and how a lot of commercial diets have grains. So can you expand on that a bit?
Right. Okay. Now, just to answer this question, I mean, it sounds like your dog had the much better start, or the much better, how can I express it? Looks like you've done everything right, and still your dog got cancer, and that's probably where other factors are coming in, genes,
like bruising.
sarcomas,
bruising, but bone bruising, I think, was something that we often overlook. So talking about prevention, having arnica on hand, if your dog gets a knock on the arm or something, maybe doing that. So that was just something that came to mind as a prevention.
That something has happened down the line that has triggered the osteosarcoma, although your diet is very, very good. Now, I've just heard David say there's rice in the diet. Take that out. Take that out. We don't want any carbohydrates in there for a cancer patient. So replace that with more meat or more veggies, or different types of
Or eggs,
veg-
even some eggs.
Yeah, yes, eggs definitely a good protein source. Yes, eggs you can certainly do that. If your dog still can exercise, I know with osteosarcoma it's very, very difficult. Try to.
What about swimming with these sorts of dogs?
Absolutely, if
Yeah.
you're a hydrotherapy center
Yeah,
nearby,
yeah.
yes, and your dog is not frightened to death, depending on the type
Yeah.
of dog, one will happily jump into the water, others will be so scared. So, but it would be, if the dog likes to swim and is not scared about the whole process, then swimming would be a good exercise for an osteosarcoma patient.
Yeah. So the other thing, I'm not sure if this dog's using any of our herbs. No, okay. So then maybe we talk about the osteosarcoma protocol.
Yeah.
Yeah.
Okay.
Yeah. Do you want to explain that?
Yeah, okay. So our osteosarcoma protocol is the osteosarcoma support mix, what has elecampane, violet leaves, parsley, rose hips, wormwood,
Wood,
yes.
yep.
Basically addressing the problem, and also addressing it also probably has equisetum
Yeah,
in it,
it's got equisetum
with bearing in mind that this cancer could have resulted after a trauma, and then we go in with our conditioning mix.
Yep.
For the deep detoxification and the maritime pine bark. And additionally to that, we use our colloidal silver. We use colloidal silver for 3 reasons in cancer patients. One, for the antibacterial support. Wherever tissue is destroyed in the body, you like bacteria to settle there and complicate the disease. Then colloidal silver is also antiviral, and in some cancers, the virus, it could be virus related, or virus could contribute to the disease. And then also there is the possibility that a colloidal silver interferes with the cancer cells. When the cancer cells take up a silver ion, that it isn't as protected anymore. So
I think one of the things that I thought was that the silver molecule connects with an oxygen molecule, and that can act as a Trojan horse and bring oxygen into that cancer cell. So there's certainly been some interesting ideas about how colloidal silver may work. These are purely hypothetical. There is a lot of studies done on antibacterial, antiviral elements of colloidal silver. That's absolutely scientifically proven. These other reasons we use it are things that we've just read in as a theoretical possibility, and I think also add value to the rationale as to why you would use it.
Yeah. Okay. And then of course a very, very good diet, and with lots of fresh veggies and fresh foods, bones, so everything. What is important for healing.
And of course, pain relief is something else that we would also look at.
Of course, yes, we have our osteosarcoma anti-inflammatory healer as an additional mix for patients that are in severe pain or don't respond well to the initial treatment, and that covers the inflammatory side of the disease.
That's right. And that what you'll often find happening is that a lot of vets will then start to put your dog on pain relief.
Yeah,
so
what they need probably.
Which they definitely still need. So we're not saying you don't do those things. But what we find is that by partnering it with the anti-inflammatory, often the pain relief that you're giving is often less. You don't need to give as much as of the vet medication. So which is of great benefit, because the medications can have their own complications, particularly for kidney function. So more questions?
Yeah, so Mark, who asked that question, says, thanks very much. He'll remove the rice from the diet. He is on the osteosarcoma support mix, and the dog swims every day. So he's doing everything he can there. So that's good. Now we've got another one on the email. We've our 3-year-old dog has just had surgery for a facial fibrosarcoma, left side of head on top of back of ear. What treatment would you recommend?
Okay, so that's the hard tumour.
Yeah, we have a fibrosarcoma support mix as well that will be combined with the maritime pine bark and the conditioning mix as well, and a really good diet, homemade diet. Yes.
So these sorts of things, if it's inoperable, because sometimes these cancers can be operable, and I think I'd like to talk about that, because sometimes if it's possible to remove these cancers, I feel that it's a good idea. Is that your feeling as well?
Yes, it's definitely buying us some time for the herbs to correct the underlying issues. If it's a facial fibrosarcoma, surgery is not that easy, and sometimes the surgery is incredibly aggressive. So you have to weigh up really the benefits from it. And poor dog is just 3 years old. This is really sad to hear. Just in young individuals, they get younger. They always get younger.
Yeah, I know, and it is, and I think it's a real symptom of our current world, which is, I think just the fact that we're seeing pandemics on the rise. We're seeing, obviously, I think I just read Siberia had the hottest day ever recorded, like 30 degrees or something in Siberia. We're living in unprecedented global times where we're beginning to understand that what we do on one side of the world will actually impact the other side of the world, that we're all in this together. And I think we're seeing everyone and everything being affected at some level. So we need to be protective of all of these things and be understanding and about what's actually happening and how we are continuing to contribute to these things. I think another study I've just read in Melbourne was the amount of antidepressants that were actually flushed down the toilet. Human medications flushing into our waterways is impacting and possibly going into our food chain through some weird loop. And it's been going on for so long. So we don't actually know, because there's not enough studies being done on understanding exactly what's happening. But I think we can be common sense here, and we can make the leap that there's something not good happening.
Okay, so you've opened a can of worms now about the environment.
Yes.
And the environmental effects on our animals' health, or everybody's health, but animals' health. So someone did mention water as being a possible. So let me just go through the various things you're going to have to deal with here.
There's
water
all very
being one.
topics.
Okay, so then the next one is one had a burst tumour in his spleen area and was living next to a smart meter. Could this be a contributor? The next one is the dog had, sorry, just got to find it, a lymphoma, canine lymphoma. And is there a link between that and the vaccinations? So there's vaccinations. I know this is a difficult one, but there's so environmental effects and vaccinations, and are there herbal protectors? Is the word somebody used? In other words, is there something they can have?
Well,
here we go. I'll pass you on.
Do you want to talk about the lymphoma and the vaccine, maybe?
Well, look, it's so difficult to say, and usually cancer is not the result of one single thing.
That's right.
It is a combination of a lot of things. So we can't, while, a lot of things can contribute to it, but we cannot point to one thing and say, this was it.
It's a bit like
very rarely,
you can have the straw that broke the camel's back. Okay, so you could be, your body could be under enormous amount of burden, and then there's one thing you do that tips you over the edge, and so that's what we mean by it's a multifactorial.
Yes, multifactorial. It's definitely you cannot blame one thing. for it.
And I think this is what we're trying to get at with the environmental things, is that everything combined is now resulting in what's happening now globally. So that's why everything needs to change. It's not just one thing that needs to change. It's not just about getting rid of one pest, or it's not just changing one thing. It's we have to have a holistic response.
Yeah, and that's why our treatment programs,
trying to address those things. If we're talking about lymphoma, that obviously is directly affecting the immune system. It's the lymphatic system, which is your primary immune system organ. I suppose that's what you call it, isn't it? System.
Sounds good.
System. And when I was doing a lot of research on lymphoma, and I look at the lymphatic system, it is the most overburdened. It's the area which gets a lot of toxins pumped into it. I mean, it's where the body wants to go, right, I want to get rid of rubbish out of my life. Boom, it goes in, gets funneled into the lymphatic system. Now, the biggest thing with people and animals that have poor lymphatic drainage is lack of exercise.
Can I ask you a question about lymphoma? Because one just came in.
Yes.
Have you had a dog recover from B cell lymphoma on your remedies without chemotherapy?
We don't necessarily differentiate between B and T cell.
I would say yes.
Yes, we have. Yes. Yeah, absolutely. Yeah, and people and horses actually as well. Lymphoma is one of those ones that if we get it early enough, we can really help. It's in a way it's almost easy. That's an easy cancer for us. when I think about all the cancers that we do try and help people with, I often think, oh, it's just lymphoma, which sounds really a bit cheeky, but it does seem to be, if we catch it early enough, it is something that we get quite a good deal of results with. Look, it's different with people. Can I just point out that animals are so much easier to treat than humans. Humans, I find, have so many more emotional complications going on there. That's one of the biggest barriers to a successful treatment for people, as opposed to a dog, which is living in his happy days. I don't know if you've ever seen that movie, Mr. Spanley, or I think I forget what the movie's called. Anyway, it's a really cute movie about this dog that was reincarnated as a human, and it's really a clever movie. But it just reminds me, when they talk about how dogs are experiencing, like what their experience is, it's a very direct experience, and I really liked that idea of it. So they've got a much simpler emotional connection with everything, as opposed to humans, which tend to overthink things and complicate things, and they've got really long memories and traumatic memories and things like that, which cause massive problems in the healing process.
Now that leads us to the question: is there a herb that prevents cancer? Yes, you can certainly do a detoxification program. I would say not long term, but the conditioning tonic once or twice a year for a healthy individual, and also the maritime pine bark if you want to, prevent diseases.
So I think prevention is always about keeping your environment clean. So obviously, if you're a gardener, making sure your dog isn't walking on your last Roundup spray.
Don't use any herbicides anyway for your health and for your dog's health.
If you're going out for a walk, and you're in a public park, find out when they last sprayed, so that you're not just, going out there, 2 seconds after they've just done a massive spray, because our public parks are definitely heavily chemicalized.
Also, be careful with the chemicals you're using in your household.
That's right.
Cleaners and also insecticides you might use to get rid of your ant problem, and just use them very, very sensibly, and make sure your dog doesn't get in contact.
That's right. Yep. That's another one.
Only use flea treatment if you really
need
have a flea problem, not to prevent it.
And if you're getting
monthly,
and if you're getting vaccines for your pets, just remember that the titer evidence is clear. After the first three vaccinations, the titer evidence is that you have lifelong immunity.
Titer testing, you can do it when your dog has to, if you want to take your dog to training classes or events, and they request vaccinations, you can opt for titer testing, and that gives you a good indication
of the antibodies.
Of the antibodies. Is your dog protected? Is your dog not protected? If your dog needs a vaccination or not. So there are healthy alternatives really out there, and just look for them.
That's right. Yeah. That's right. Got any more questions? I'm sure there's a heap of questions.
Always lots of questions.
There's always lots of questions.
Now, we've got a comment. It's not really a question, but perhaps you can say something about it. I've lost 2 of my dear boys in the past 3 months. 6-year-old French bulldog, a brain tumour. We found out it was too late. My Labrador had burst tumour, and now a third with sarcoma in her mouth, inoperable. And I also, sorry, just lost the feed for a minute there. I've lost the feed there, so there was another one that had something else as well. So it's saying to me there might be some sort of environmental issue with that, or diet issue. But
I would be very suspicious with that degree of cancer appearing in your family, in your immediate, in your animals. There is something definitely happening there.
Yeah, it's very suspicious.
Very suspicious of an external, some kind of external chemical or...
Yeah. Even in cancer patients, even have to take mold into consideration.
Yes, mold
in a house, it's also something what can contribute, what we are quite unaware of.
Well, I think that's where we come from, the idea of pathogens causing cancer. This is where the idea that viruses can cause cancer. Because viruses get inside the cell and make changes and hijacks the cell for its own purpose. So this is where squamous cell carcinoma could potentially well, meningitis isn't a cancer.
No.
Live in a mining town.
Oh, okay. They live in a mining town. So what you've got, if you're living in a mining town, I think you just need to go and talk to the council about what actual chemicals are being pumped into the atmosphere there. I think you've got a real issue of pollution in that area. And depending on what sort of mining is, I mean, they're using all sorts of different, whether it's fracking or whatever it is. I don't know what else they're doing there.
Also, if the water is polluted.
Well, I think that's the thing. It's water. It's probably the water table is being polluted because there's a lot of, if it's some kind of, there's coal washing, then there's gold washing. So it depends on what sort of mine it is. But I'd say you've got a serious water problem there.
Could well be.
Yeah.
Someone's just saying they don't believe in vaccines and got a very healthy dog, but I don't think we'll go into the vaccine conversation too deeply.
Well, we don't necessarily have a belief one way or the other. I think it's a personal
we do
choice.
have a new vaccine support program for dogs, which will be up on our website soon.
Yeah.
My golden retriever was diagnosed in April with oral fibrosarcoma, spindle cell neoplasm. Neoplasia. We decided against the radical surgery options and because we weren't giving good outcome, so we've decided on palliative radiation, but it was discontinued after the mass grew. Wasn't responding. What can we do?
Well, we have a treatment program for that as well. We also, if it's in the mouth and you can apply an oil, we have a topical treatment for that as well. When it's growing at such fast rate, we can also only go for palliative care and hoping to slow everything down. I think when you are presented with a cancer patient and you can slow everything down,
that
right?
This
is already
very helpful.
Treatment success. When we get that is already good. Just slowing everything down, bringing good quality of life back to the patient. But we have a treatment program, and we certainly can try. Yes, we certainly can try.
Absolutely.
Any more?
Someone's about to participate in a cancer vaccine trial. Is there any risk using the osteo program in conjunction with the vaccine?
To be truthful, with the cancer vaccine program, I'm not knowledgeable about this.
No,
I would have to look into that.
We would have to look into that. My experience is that with the herbs, because it is, first of all, trigger dosing, and what we're trying to achieve there is a very subtle change through the body. I don't believe there would be any interference. Any negative interference. No, not at all.
Yes.
Yeah.
So.
Yeah, but I mean, look, contact us personally, and we might do some research on that. Yeah. I think that'd be interesting to find out a bit more about that.
So the one about the mining, it's definitely a water issue with the coal mining by the sounds of it.
Right.
Yeah.
Okay.
So there's some issues there. I mean, they've had 4 dogs with those issues.
A
good water filter. Yep.
And I guess the question there is meningitis. Is there something we can do? Treatment for meningitis for a dog? Now, just wait. Don't answer just yet.
Yep.
There's more to come.
Yep.
And can you answer a question on histiocytoma? Cytoma, that one, on a paw of a dog. What treatment?
Is this the same person? No. Okay.
So I do the histiocytoma. So the histiocytoma, these skin cancers, they can come overnight, and luckily quite often they can go overnight as well. And although they are locally very irritating and look nasty, they are not infiltrative, so they usually stay where they are. And some dogs are really lucky that after 2-3 weeks they're going again. But if they are not going, we have a treatment program for that as well. It is the histiocytic sarcoma program, and we, because histiocytomas usually don't require treatment, but we have oh God, now I'm in a muddle with it, but we have a treatment for that as well. Shouldn't this histiocytoma disappear? And what you can do is you can spray it with chamomile tea just to take the soreness out of it. They can be very irritating, or colloidal silver spray over it and prevent your dog from licking it if possible. That speeds up the healing as well. And if it's not going away, then contact us and we can come up with some mixes.
Yeah, we can always do very specific mixes for very individual situations if needed. But generally, our standard formulations are pretty powerful and pretty able to address most things. Yeah. So the other one was the meningitis. Yeah. Okay, so meningitis, is it a dog with meningitis? It's a dog with meningitis. So correct me if I'm wrong, but meningitis is inflammation of the meningia. It depends on the cause. This is the coal mining one. So I think we can safely say you've got an inflammatory response, and I just wanted to sort of differentiate a little bit about the way disease processes occur through the body. You'll start with something like maybe meningitis. Okay, so any disease process that you are currently observing in your own body or in an animal's body is usually the beginning of something. Maybe the end result will be cancer. Does that make sense? So the end result could be brain cancer, because it's part of the central nervous system and the whole. It could end up. This is just purely a hypothesis, but I'm just saying that it's the very beginning stages of the body's response trying to deal with something.
Now we would have to know more about this patient. What your vet is thinking is causing the meningitis, and is there a pathogen involved, or is it a pure inflammation of unknown origin? Is it vaccine related? Here we go again. Again, could be, could not be. Again, a lot of factors come together before a disease develops. So what the factor is in your particular dog, I don't know. They're
always tricky things to try and work out what the origin of any disease process is. But once we know what the disease process is, trying to mitigate its progress is what our aim is. And of course, anything that we're doing diet-wise and herbal-wise is trying to prevent these things from happening. And of course, if there is a concern with the central nervous system, if there is a concern with how, there is a history, a genetic history with a relative, if you know that, then you can definitely do prevention. We've got our vaccine side effects.
We might have one last question before we wrap up, and it's a good one because it's about what is the recommended treatment for keeping the lymphatic system healthy?
I start with exercise.
Exercise. Swimming is very, very good, and increasing the way the body is actually getting oxygen into because interestingly, high levels of oxygen in the bloodstream, and we've talked about this actually in our breathwork session 2 weeks ago, the importance of having a really good respiration actually stimulates the everything to work so much better, including the lymphatic system. It helps to carry the toxins away, and of course, diet-wise, what you want
low in fat.
You want
don't overdo it with fat.
Yeah. So low-fat diet. You also want to have really good kidney function. So everything. So if you're thinking about what each individual cell is doing, as each cell does its respiration, which is when it brings in oxygen and then brings in nutrition and then eliminates all its metabolites, etc. All of those things go into the interstitial spaces into the body. Then they get taken up by the lymphatic system, or maybe directly into the lymphatic system, and they all need to be eliminated. So when we're talking about sluggish lymph, it's actually a sluggish elimination. So we need to improve all our elimination systems. So let's look at our liver. Let's look at our circulation, which is stimulating, and how everything's travelling through the body. We need to, support our kidney function, and of course improve the way our body is expelling air even. And all of that is related to exercise and, of course, nutrition. So you need to eliminate foods that are pro-inflammatory. Come to a neutral diet. I look at diets like this. They're either neutral, anti-inflammatory, or they're pro-inflammatory. So you either got to have a neutral diet which isn't contributing to inflammation, or it's actually anti-inflammatory. And they usually are one and the same. Then you're doing exercise.
Sounds good.
Maritime pine bark.
Yes.
As well.
And the blood cleanser. 3 months of infector clear.
Exactly. Anyway, that's our hour-long session today. It's been a great session today. Thanks so much for coming, Nicki. It's been super fun.
It was good fun. Thank you for listening.
We'll see you next week, and we'll have another interesting topic next week. We don't know what that is yet, because we do this week by week as it takes our fancy, and also what inquiries come in as well, what we decide to talk about. Thanks, and we'll see you next week. Bye.